What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. In today's video, we're going to explain what do you do if you run the exam under the wrong patient. Okay, not to get confused if you shoot the wrong patient under the wrong person. No. If you run the exam under the wrong patient, okay? So, to give you context, I do night shift. Been doing it for 4 years at a trauma 3. So, occasionally, you'll have situations where patients will come in with similar last names, and if you don't pay attention, you'll sometimes accidentally click it, or sometimes, like where you click, the portable machine will like run it under the other one because the like calibration's off. So sometimes you gotta double check. But if you run it under the wrong patient, but you shot the right patient, right? Depending on your machine, ours you can do the little drag and drop, and you can run it under the right patient. But occasionally, you'll have to go into the system, the packs, and delete it off the original patient you shot it in, because it does it'll just like copy it. So it'll be under the good patient and the other patient you shot it under. So sometimes you'll have to delete it. Everything can be saved unless the rad reads it. Once he slaps the report, then you're kind of in trouble-ish. So, if you know you messed up and it's still in the local network, you're good. You can save it. If you put it online and it's suspended, you're good. You save it. Or if you put it on hold, you're good still. But once it goes online and the rad reads it, yeah, and the best bet is you can call and tell them. But if once they slap the little report on it, then it becomes a game of how quickly can you talk to your manager because you messed up. And if the rad doesn't, usually the rad does a good job of catching it, because like the anatomy they'll look at the priors and it will look different because different people, different body. But occasionally the patient doesn't have a prior, so like they just assume that's correct. So then it gets kind of difficult, because if they're getting something done, wrong diagnosis, and it can get pretty nasty. But most of the time it'll get caught by the rad, or you catch it, you'll look at it, and then you'll have to talk to your upper management, and they have to come into the system, and it's a little bit time consuming, but it can be fixed. That can be fixed. The problem is if you shoot the wrong patient and it wasn't him, then you're in a whole different realm of problems. Because if you shoot the wrong patient, then that's bad. That one, there's no fixing that one. Like, you expose radiation to the wrong patient. Occasionally you'll get lucky, and that patient did also need a chest x-ray occasionally like that. But sometimes, if they didn't need it, then you're liable, and it can get pretty nasty in those situations. So once again, it's always better to double check everything before you expose, because once you expose, can't take that one back, can't fix that one. So always double check this stuff. And yeah, it's been your boy Miguel. See you on the next one.